Good morning, delegates. I wish to thank Jean and Alzheimer's Europe and Charles from the Maltese Dementia Society for giving me this opportunity to share the work that we're doing at the University of Northampton in raising the profile of the care and needs of those with young onset dementia within our region in England in the UK. In this speech this morning, I want to introduce my interest in young onset dementia and where that came from. I want to give you a very brief contextual background to our dementia research network at the university and why we are focusing on dementia and particularly young onset dementia. And then I want to focus the vast majority of my speech this morning on the work that we are doing to develop a social model in Northamptonshire. I want to tell you that 25 years ago, as a young student nurse on an acute general mental health ward in Yorkshire in the UK, in the north of our country, in a hospital such as this, I encountered a young lady who was 35 years old and had 6 children. It was in this hospital and on this ward. I will stress that the ward was an acute mental health ward, not dementia specific, and she was my first encounter of somebody who was subsequently diagnosed with young onset dementia. Later in my nursing career and in my academic career, I have had the opportunity in moving to Northampton, which is in the central region of England, to become chair of the Dementia Research Network in the Institute for Health and Wellbeing at the University of Northampton. Northampton, our first speaker spoke about football in Scotland. Northampton is famous for Silverstone, racing car sports. Why did we focus on dementia at the University of Northampton? This diagram of the UK highlights that in the central region, denoted in red, the large red section in the centre, is the number of dementia cases and the complexity and the appropriateness of the care and the diagnostic gap in England. Our first speaker spoke about 44% poor diagnosis or low diagnosis of dementia. In the UK, the central region, or certainly in Northampton and Leicestershire, where I work, it is higher than that in terms of the diagnostic gap at 47%. It was therefore identified by our local stakeholders that the area that they would like us to focus on in our dementia research network was, in our mental health research network, was dementia research, and we would focus predominantly on young onset dementia. Our Dementia Research Network developed and was launched in 2010, and it developed its first strategy in 2011-12. This coincided with the launch of the National Dementia Strategy in 2009 and the subsequent implementation plan in 2010. Subsequent to that, we are one of the few universities in England that have joined the Dementia Action Alliance in 2012. We have a number of stakeholders in the Dementia Research Network. I will not go through them all, but just highlight that they are varied and include general hospitals, local universities. We're developing international partnerships, and we were fortunate to recruit 4 PhD students who work on dementia. 2 of those focus entirely on young onset dementia, one looking at theatre studies and one looking at frontal temporal lobe dementia. Again, I will not go through the whole of the slides, but we wish to focus, as you can see on our strategy, on early diagnosis, particularly as this is prevalent and a difficult area in our region, as I've already highlighted. The other area that we wish to focus on, and came up from our studies, which I will just mention in a little while, was developing a social intervention model. And they have become the two cornerstones of our strategy for young onset dementia. The aim of our strategy in 2012-13 was looking at exploring the care and treatment experiences, a person-centred approach for dementia, people with dementia and their carers, from initial diagnosis through to end-of-life care. More specifically, in young onset dementia, we are working with a number of people who have been touched by the disease and their carers to develop a programme of studies that reflect the needs of the local community and fit with the national strategy of looking at access and integrated care. We are therefore begun, and particularly through our social group, the recruitment of people with young onset dementia and their carers into these programmes of studies. And in return, together with Alzheimer's Northamptonshire, as a university, we are offering them an opportunity to meet together in a social group, which is what I wish to focus on this morning. I wish to just give you a brief overview of some of the people that we're working with in our group. Obviously, these are not their own names. I have changed them. Alison is now 52. Her symptoms started when she was 48. It took 3 years to reach that diagnosis. Her husband is still working. He works driving lorries from 12 o'clock at night to 4 o'clock in the morning when his wife is at home, asleep in bed, and he knows that she is safe. He texts her to make sure she is up in the morning. He texts her throughout the day to make sure that she is at home. 3 years after diagnosis, she has begun to require and want to meet with people who are the same age as herself. Initially, following diagnosis, she attended dementia cafes. She also has had an opportunity to access care within Northamptonshire twice a week to meet with other people who have been touched with dementia. She is the only lady who is under 55 years of age. Myra and Peter come from another part of our county, another part of our region called Leicestershire. Myra started with symptoms when she was 62 years old. In 2008, she was diagnosed with Alzheimer's disease at the age of 66. Her husband had not noticed that her behaviour had changed. He was working away a lot. He had an independent lifestyle. He had not noticed that when she went rambling, she would not answer questions herself, but she would defer to her husband to answer them for her. Eventually, she went to the GP, supported in doing so by her daughter who lived in America, who had come over to visit. Her son, who lives in Australia, had noticed previously, a year earlier, that her condition had altered. They did not know what was happening at the time, but after 2 years, the daughter from America managed to talk parents to going to the GP. Finally, she was diagnosed with Alzheimer's. My third case is very, very recent and is very reminiscent of my early experiences as a student nurse, and one that has hit home quite hard. Mary, recently diagnosed, is 35 years old, has 2 children, young children. Her mum and partner are caring for her. They are trying to get access to care that is appropriate to her age group. It has proved a challenge. She has spent 12 weeks on a general mental health ward where appropriate access can be found. You will remember that is resonant of my earlier example. So young onset dementia has various names. Early onset, I prefer to use the word young onset, people who are of working age, who are less than 65 years old. In the UK, all parts of the UK should have access to geriatricians and specialist care. Unfortunately, that remains somewhat patchy in some parts of the country. Certainly in Northamptonshire, we do have young onset specialist nurses and we have young onset dementia teams. But the access of aftercare following diagnosis is not available or as accessible for all. Since diagnosis, Angela's husband has not yet met with the GP. That was a year ago. He has frequent visits from the young onset psychiatric nurse and attends a carers group for 2 hours a week. We know that young onset dementia is not as common or as frequent as later onset. Figures vary. In the UK, you can see figures between 15,000 cases in 100,000, 15,000 cases in the UK, as high as 21,000 cases. It's not high. However, they still require access to specialist services and age-appropriate care. We know that Alzheimer's disease is the most frequent or prevalent within young onset dementia. This is followed by frontal temporal lobe dementias, but there are other rarer forms that affect younger people. I will not go through that in great detail, just to highlight that because of the atypical presentation that many young people with dementia present with, diagnosis is often much more difficult, has major impacts on family life, as demonstrated in those 3 cases, can affect children, education, mortgage, and civil responsibilities and civil opportunities. Unfortunately, people with young onset dementia still want and would like to access normal parts of civic life. Somebody possibly having been touched with frontal temporal lobe may wish to still go out for Sunday lunch, may want to go to the theatre, may want to go to children's school, may want to access all the normal parts of family life that we would want to access. And certainly we have undertaken, in order to develop our social group, a small project looking at what their specific needs might be. Through our questionnaire, we have explored the views of people with young onset dementia and their informal carers. We have surveyed what they would like to receive in a community-based social group. Again, I will not go through this in great detail, just to highlight that the respondents felt that they would benefit from a separate service for people with young onset dementia, that age is currently a barrier to accessing many current services for dementia care, that people with young onset dementia would like locally based services but are willing to drive up to 30 kilometres to access something specific, would like to meet together with their partners every 4 weeks for at least 2 hours, where they can discuss other things other than dementia. However, they would also like to discuss dementia and forms of support as well. I will not go through these quotes in great detail, but just to highlight that the people in the survey wanted a separate service, and how might this be achieved? Wanted more specialist, locally based services. And wanted to develop their own programs of activities that focused on normal connection, social connection, not becoming isolated, where they could meet together and engage in normal activities like dinner times, evening meals, and theatres and cinemas. We have therefore commenced and is successfully recruiting to our social group for people with young onset dementia and their informal carers. They have chosen themselves to call themselves the Forget-Me-Nots. The group meets monthly for 2 hours. The venues are all variable and community-based. The aim of the group is relaxation and socialising. The group is going to be for the members and developed by the members. We currently have 12, I put 11 here, we currently have 12 members in attendance, but we have 4 more couples that wish to join. Finally, in support of this, we have commenced and are undertaking a project also entitled Forget-Me-Not Project, exploring the experiences of carers of people suffering from young and late onset dementia. We wish to explore the experiences of people with young in comparison with late onset dementia. The study has gone through ethical approval. We are interviewing people with young and late onset, and they are the result of the cases that I have shared with you. In summary, and I will leave you with my conclusions, the stories for carers for people with young onset frequently illustrate the enormous physical, psychological, and social impact of the disease. The stories describe confusion following diagnosis, social isolation, and a lack of specialist formal and informal support. The studies support the view that carers of individuals with young onset frequently experience difficulties in receiving timely diagnosis and therefore can experience challenges in accessing appropriate specialist support. Clearly, and in my final comment, there is a need to raise special awareness to the formal and informal care experiences of people with young onset dementia and their carers in order to raise the profile of the need for more rapid access to specialist social and psychological support to both the individual and their primary caregiver. Thank you.